For decades, this blue sign has stood for universal care in the UK. But for those seeking dental treatment today, the system is failing to reach the people it was designed to serve. Accessing basic dental services now requires a level of persistence that many find insurmountable. For a vast majority of the population, the traditional path to a checkup has effectively ceased to function. Currently, 97% of practices are no longer accepting new adult patients, leaving a tiny 3% sliver of the market. This creates a critical gap for the over 50s, as private care costs become prohibitive for those on a fixed income. Because standard registration is no longer a reliable option, you cannot wait for an opening. You have to take a more aggressive, tiered approach to secure treatment. Your first required action is to consult the NHS Find a Dentist online tool. Enter your postcode to see which clinics are officially operating in your vicinity. However, this digital record is rarely accurate in real time. It relies on clinics to update their own status, meaning many practices listed as available may have already reached capacity. To get an accurate picture, you must call clinics directly. Ask the receptionist specifically for adult NHS slots and inquire about internal waiting lists that aren't published online. You also need to broaden your search. This map shows how widening your radius to include adjacent postcodes and commuter towns can reveal opportunities that don't exist in your immediate neighborhood. Finding a routine spot in 2026 is no longer a matter of convenience. It requires manual outreach and the flexibility to travel further for an appointment. The criteria for access change if you are in physical distress. Severe pain, significant swelling, or a suspected infection allows you to bypass the standard registration process. In these cases, the NHS 111 dental helpline acts as the primary gatekeeper. Advisors there have the authority to refer you to reserved emergency appointments that are not accessible through normal channels. Your Regional Integrated Care Board oversees specific dental access centers. These facilities are commissioned to treat patients without a regular dentist who require immediate intervention. But there are strict limits to this route. These centers are designed for stabilization and pain relief. They do not provide long-term preventative care, like full examinations or cleanings. The emergency pathway is a vital safety net for resolving acute problems, but it doesn't provide a permanent solution for your ongoing dental health. When local practices and emergency services aren't enough, you have to look towards the specialized tier of the NHS infrastructure. Academic institutions, like the University of Birmingham, offer a different route. Here, dental students provide supervised treatment at a significantly lower cost than private practices. Most of these schools are in major cities, such as Manchester. You'll need to contact them directly to understand their current acceptance criteria, and you should plan for appointments to take longer. There are also dedicated dental hospitals. These provide specialist care and occasionally accept general patients, usually through a referral from a GP or the 111 service. Finally, community dental services exist for highly vulnerable patients, including those with mobility issues. Access to this specialized route is strictly via a GP referral. While these institutional options are harder to reach and require specific referrals, they demonstrate that the system still has capacity if you target the right level of care. Successfully securing a place on an NHS patient list is a hard-won result. Once you are registered, your priority shifts to maintaining that status. The most common way to lose your spot is through inactivity. Practices frequently remove patients from their lists if they fail to attend an appointment within a 24-month period. Retention requires following strict protocols. Attend every scheduled checkup, provide notice for any cancellations, and ensure your contact details and address are always up to date. Even if you choose to pay for private work elsewhere, you must continue to use your NHS dentist for routine visits. Regular attendance is the only way to keep your registration active. Navigating the 2026 dental system requires significant effort to enter. By following these retention rules, you ensure you remain inside the system and avoid ever having to restart the search from scratch.